What is recommended for inner corner upper eyelids and the puffy bags that form under my eyes that only show when I smile? I had a facelift in 1995 and only remember I had a left droopy eyelid that was corrected and had some problem healing the lid. Often the inner corners look puffy or like extra skin folds, and eyebrows don't look particularly symmetrical. My under eyes look great until I smile, and then you see many bags form. Is a full blepharoplasty recommended or what? My biggest problem is when I smile. I have eye bags. When I'm not smiling, my mouth looks mad.
Thank you for your question. It is clear by your description of your question how frustrated you are with the challenges of having, quote, bags under your eyes when you smile, and that when you don't smile, your mouth looks sad. You describe in your question that you had a facelift in 1995 and that you also had a drooping eyelid that was treated and that had some issues with healing. So I looked at your photos, and certainly there are some ongoing issues that can be a source of concern, but I think you need to kind of look at the big picture a little bit. First of all, looking at your eyelids at rest, it appears from at least the photos, one of the photos you submitted, that there is some puffiness. Now, it's not a lot of puffiness in the lower eyelids, but there is some there. So the nonverbal communication of puffiness, especially when your face is at rest, is that you're tired or that you're lacking energy. So that's something to at least evaluate. Now, the dynamic activity of muscle action when you smile, there are two aspects to smiling that certainly challenges many people who come to us. First is the wrinkling that is related to the activity of a muscle called the orbicularis oculi muscle. This is a muscle that surrounds the eyes and is responsible for supporting the eyelid and allows you to blink. So, although Botox can be very effective for crow's feet lines, the wrinkles that form under your eyes can be helped a little bit with these neurotoxins such as Botox, Dysport, Xeomin, but there is also another factor that I think you're also maybe somewhat aware of, and that is the recruitment of skin when your cheek moves up. I always tell my patients it's kind of like an accordion. When you smile, just the movement of the cheek upward will push skin against the eyelid and create wrinkles. Now, yes, there is going to be a difference between how they look when you're 40 years old to compare to when you're 60 or 70 years old. And a lot of this has to do with the skin quality and the thinness of the skin. But understand that there's no way to completely eliminate those wrinkles, but there are strategies to help improve the skin quality. I think that one of the things that many people do, and the people who come to us, in so many ways resonate with my own personality in that they're very exacting, they're very obsessive, and they really look at details very carefully. But unfortunately, a lot of times when people look at details too carefully, they certainly lose the forest for the trees. And I think that when people look at you, and this has been proven in many psychology studies, we look at ourselves in detail while other people look at the big picture. So, you're in a position where you're concerned about the wrinkling under your eyes and how you'll be perceived, so that when you smile, you see so many wrinkles, but certainly when you don't smile, the mouth looking sad. Well, think to yourself, what do people think when they look at you? And if your mouth looks sad, then they're going to naturally think you're sad. I wrote a book a few years ago called The Fine Art of Looking Younger. And there is certainly a strategy, being a surgeon and being a multi-specialty surgeon, I have the opportunity to do a lot of things for people and literally be their beauty doctor for their lifetime. And so many of my patients I've been in practice for 20 years, and so I have helped them at one stage when it was their eyes, another stage when it was their jowls, and critical strategic solutions that are minimally invasive and that allow for a natural appearance has been my overall philosophy. And so I think that considering to have maybe some fillers, maybe to have some volume enhancement, something we do also is called where we put Botox or Dysport in a muscle called the depressor anguli oris muscle to lift the lips. All of these things that can help the area around the mouth, or as we refer to as the perioral area, can help get that overall look to improve. As far as the wrinkling under the eyes are concerned, when you reach a certain age, the skin gets very, very thin. And especially if you've lived in a sunny climate or you've been exposed to a lot of sun. What we typically do is we do something called the use of platelet-rich plasma, where we'll inject from your own blood, after we spin it down, a part of the blood called platelet-rich plasma. And platelets are the cells that are responsible for healing when you have a cut. And we have found that we've been able to help people with skin quality. Now, a lot of times what we'll do is we won't just do it under the eyes, but we'll do it throughout the face to get this nice glow. You see, platelet-rich plasma has this unique characteristic, unlike other fillers, where it has something called vascular endothelial growth factors. Basically, when you have an injury, you need blood supply. And so essentially we're kind of mimicking the equivalent of an injury, but doing it in a very strategic way under the skin. And uniformly our patients come back saying their skin looks like it's glowing and it looks really good, and their friends compliment them on their skin. So you may want to take a step back and consider some of these strategies as a way to help you improve your overall appearance and maybe focus a little bit less on the specific issue of skin under the eyes. Be very wary that a plastic surgeon may say to you, well, let's remove some skin. Now, looking particularly at your left lower eyelid, you appear to have a little bit of sagging or pulling, which is almost like what we call a lid retraction. So be very, very mindful of not taking away skin, because skin that is recruited during dynamic activity will not be there when your face is at rest. And people come to us from all over the world with a condition called lower eyelid retraction because their plastic surgeon, with the best of intentions, tried to remove skin to address their issue, and at rest the eyelid pulled down. So just be mindful of that. So understanding that we're looking at skin quality, we're looking at some other maybe residual puffiness under the eyes, and an overall strategy to enhance the face as opposed to focusing specifically only at the lower eyelids. So I hope that shed some light to your concerns. I hope that was helpful, and thank you for your question.